What else can you use? Everybody's familiar with those beautiful yellow flowers that really this spring were prolific, right? Dandelion. And the other one that grows, the monarch butterfly? Milk thistle. Okay? I'm not a real big proponent of going out and picking milk thistle and trying to consume it. I'd prefer to use it in herbal preparation or something of an extract. Dandelion, though, how many of you have ever eaten dandelion greens? They're actually pretty palatable. And if you actually see, in our area, if you watch the deer and the elk, when they're really growing their antlers rapidly, there's a lot of protein in dandelion greens. And they'll actually just sit and feed on those dandelions and their antlers are growing up to 6 inches a day. That's pretty significant growth. But again, when you look at the hormone production and the amount of nutrients that are required to grow that type of an antler growth, that's pretty significant. So beets, dandelion, and milk thistle are the most common ones that you'll see on herbal preparations, okay? But we've talked again, and if you refer to the antioxidant presentation on our videos, you'll see again glutathione and activating glutathione in the system. Glutathione levels are a hallmark to true reduction of oxidative stress or free radicals in the body. Okay? So anything that we can do to stimulate or upregulate glutathione is going to be very helpful. Okay? Any other questions then, perimenopausal? Anybody that that has come or asked about this that has a specific question regarding perimenopause? Anyone that's looking for a specific answer tonight?
I have a question.
Please.
What causes endometriosis?
Great question. So the question right now is then, related to fertility, a cause of endometriosis. There is a research study that actually has shown 46% of females with endometriosis have an anteriorly displaced tailbone. So this is a fractured tailbone or an injured tailbone. The tailbone, if we look, brain, from the brain down through the brain cord or spinal cord, all the way down to the end, there is a sheath around the entire central nervous system. It's like a skin, okay? And it's called pia mater. The pia mater is right in contact with this central nervous system and runs all the way up around all this connective tissue. The spinal cord actually ends at the level of the belly button, okay? So between L1 and L2, the spinal cord ends. And from that point then we have individual nerves that continue down and form the sciatic nerve, the tibial nerve, peroneal nerve, the nerves that give innervation to the lower leg and the lower extremity. This surrounding sheath, though, of pia mater actually tethers at the tailbone and is called the filum terminale. And the filum terminale, because it's pia mater, the sheath around that central nervous system, if it's tethered or pulled and stretched, it will actually change the innervation to the lower sacral plexus. Okay? The sacral plexus of nerves gives innervation to the uterus, and what happens in the case of endometriosis, remember there's ectometrium outside the uterus, there's myometrium, which is the little muscular layer inside the uterus, and then finally there is the little lining inside that will sustain the implantation of the placenta, which is called endometrium. The endometrium is that little bit of tissue that's sloughed off during the period. When the progesterone levels start to wane, then the endometrium starts to slough, and that's what my menstrual flow or period is. What happens though, if the filum terminale is tethered and the sacral plexus of nerves is imbalanced, instead of having a normal peristaltic wave that goes out and ejects, it actually starts to wave opposite, retrograde, and now we have endometrial tissue that goes up the fallopian tubes and implants inside the abdominal cavity and becomes extremely painful. Okay? So the hallmark sign of endometriosis is what?
Tailbone.
Tailbone is the cause. The hallmark sign is brown blood, right? My period starts brown. Okay? The reason for that is the endometrial tissue that is now in my abdominal cavity cannot flow out or flush out because my tubes are tightly closed. Then, during the middle of the month, I ovulate and those tubes open up and they'll catch the egg, which allows then the egg to migrate down the fallopian tube into the uterus. Well, at that time, now I have brown, rotten blood from my peritoneal cavity that enters into the uterine horns and comes down, and so I may even spot blood, brown blood, during the middle of my month during ovulation. Then, when my period actually starts, there's this cesspool of blood that's been hanging out, and it actually starts to flow out, and it's brown. Okay? So we look at endometriosis, hallmark sign, brown bleed leading into my period. Okay? Does anybody know of someone that's had brown show at the beginning of the period? Absolutely. And that, again, is hallmark to endometriosis. All right? Does that answer the question?
Well, what do you do about it?
Fix the tailbone. So the question is,
It's in the wrong place.
yep, what do you do about this? You fix the tailbone. Okay? You just grab that handle and lift it right up and it's fixed. So there's a way to actually adjust it. Okay? So that's what we find very commonly with endometriosis. And also then sometimes we'll find that there's some other type of innervation imbalance due to either a pelvic imbalance, some type of an injury to the pelvis, a slip and fall. Those are very common. So that's about half of it. Now, some people just have had endometrial tissue from birth that never actually was in the right place. Okay? As the body was differentiating, the endometrial tissue did not stay confined to the uterus. And I've actually seen ladies with endometrial tissue on their navel. So every month they actually have this proliferative, what looks like a red swelling skin, and then it will kind of get scabby and bleed a little bit and be gone. And then it stays a little bit red, and then about the middle of the month it starts to swell again, and it actually respawns, and they actually have this ectopic endometriosis. Okay? When you see it, you'll know exactly what I'm talking about. Don't search for it, it's out there. Right? But sometimes during formation, the body doesn't get all of those tissues differentiated and compartmentalized, and it ends up manifesting other areas. So that's sometimes where we'll see it is right on the navel. Okay? And then, therefore, endometriosis, it's also then the endometrial tissue didn't differentiate and get confined to the uterus, it's in the peritoneal cavity. The tissue is already there. So when the hormone starts to wax and wane in my teen years, it starts to respond. That may be an embryologic anomaly that I have. Okay?
Nothing you can do
Fascinating.
about that?
What was the question?
Oh,
So the question is there anything that we can do about that? Absolutely, there's something we can do about it. We use a different group of herbs, and we do then check this. This one is the most treatable. Okay, I've actually seen a case of a lady who had infertility. We fixed her tailbone. She had no children. She'd had 2 children, no children, 6 years. She and her husband were ready to give up, and she came in. Is there anything we can do? Fixed her tailbone. She came back. I missed my period. Carried the baby to term. Did great. Okay. Another gal that we had. She had a baby. Then she couldn't have children. She had broken her tailbone during delivery. She got pregnant after we fixed her tailbone, and she was pregnant with twins. Carried them almost to term, and then lost them. That was really tough. Fixed that again. Now she's had 2 more kids. So that was an exciting and also a devastating case. All right. Just as a side note, though, how many of you know somebody who's had spontaneous abortion or preterm labors in the first trimester? Anybody know somebody with that? Okay. First trimester spontaneous abortion or loss of baby or fetal demise, we see very consistently associated with something called anticardiolipin. So we'll talk just for a moment about a couple of things that cause infertility. Anticardiolipin antibody is an antibody that actually creates a clotting factor at the interface between the uterus, the endometrium, and the placenta. And it actually causes a big scab or a clot to form, so baby no longer gets oxygenated blood from mom. And so there's a spontaneous demise in the first trimester. Okay? If you've had more than one miscarriage in the first trimester, check anticardiolipin antibody. Okay? It's one of the easiest things to treat. So here's a young lady that came to us. She and her husband have had a baby. After their first baby, she had 3 miscarriages. She came to us in tears. I've been everywhere, can't get pregnant. It's been 4 years. I've had 3 miscarriages. I'm ready to give up. And I don't want you to tell me something that's just going to give me false hope. Has anybody run your anticardiolipin antibody? No, I never heard of it. Ran the antibody. It's elevated. We treated it. 3 months later, she's pregnant. Carried baby to term. Beautiful child. Okay? Pretty exciting. What then of the 3rd trimester spontaneous abortion? We're actually looking at lack of progesterone. Okay? So, if a person has PMS, she's already estrogen dominant, then things just kind of line up right to where she gets pregnant, hooray, and then she carries baby through 2nd trimester, been sick as can be, morning sickness finally subsides, 2nd trimester, hooray, I'm home free, and then all of a sudden a spontaneous demise in 3rd trimester. Progesterone lack. Okay? So we always want to look for that as well.